Hello, welcome to this week's video. I hope you're all well. So I got to listen to an amazing seminar the other day regarding the science behind medical needling. So I wanted to have a little chat about it. It was with Dr. Matatas Ust, who he's kind of like Dr. Des Fernandi, who's the creator of Environ and one of the world's leading plastic reconstructive surgeons. Dr. Ust is like his protege. So he's also, he's a plastic surgeon. He practices in Germany, and he did a wonderful seminar on the science behind needling. He does a ton of needling in his clinic, and he definitely has showed some pretty amazing evidence for why needling is still the most effective when it comes to skin rejuvenation. So personally, I am still deeply in love with it because of all the things I've played with. Nothing really has been so safe and effective. I worked a lot with different forms of fractional lasers and sublative in my younger career, but because laser is the death of tissue, so it's creating that it's kind of similar to needling in the sense of it's hitting the dermis and creating a wound, but it's ablating, so it's creating every little section, it's creating ablation of the epidermis, and then with the heat there is more risk. So it's the death of tissue that then stimulates the wound healing, where with the medical needling, every time I puncture in that needle and it comes back out, that tissue can simply heal. So there's no destruction of the epidermis at all. So that's why if you had a needle and thread and you were sewing and you pricked yourself, well, it wouldn't leave a scar. So it's called scarless healing. And what I'm doing is I'm creating a bleed, and in that blood is the growth factors. So the more I can get the tissue to bleed, in my opinion, the better. And then I'm wanting to combine my treatment, not just with the platelet release, I want to combine it with other therapies. And what I combine it with will be different depending on the client's needs and the client's health and how I'm treating. Am I treating 7 days apart? Am I treating once a month? How am I practicing this course of needling with this individual client? So when I'm not using any heat and I'm just using that trauma or a wound in the dermis with the needle, but then the epidermis, the top layers, close straight back up. They said in the seminar within 10 minutes they found the holes actually close back up. But what's happening underneath the skin, the body is releasing the human-like growth factors. So it's actually regenerating, it's getting healthy oxygen to revitalize, fresh blood supply. The matrix is showed in before and afters of different scans. It actually showed like just the volume of the skin dramatically improving, and obviously the product penetration improving. So if you have like a scar doesn't have any blood supply, it's damaged tissue, so you're remodeling that scar by placing all that wound in there. It's just amazing. But if I compare that to the death of tissue, unfortunately with the death of tissue, you have to heat it. So then you've got that risk. Because once you heat tissue, if you've got pigmentation, could hyperpigmentate, which means it's going to leave a scar. With the death of tissue, you're not getting the natural collagen responding. They also showed that you don't get the elastin regeneration, where with needling it's tricking the body to repair itself, so you're getting collagen, elastin, but you're getting oxygenation. So that's why it has been really effective. I've used it with clients with acne, particularly if it's not cystic, if it's just it's controlled but it's getting a little bit of breakout. I've seen by oxygenating that skin, but the clear benefit is combining it with different therapies. So let's say I've got 2 hours with my client. After I release the platelets, I'm now going to combine several therapies to now treat that skin depending on what I'm seeing. So that's just the benefit with having all this amazing environ treatments to stack on. And that's where you really see a lot more results. Now, if you are preparing for a marathon and you don't have any healthy ability to eat well, you haven't been practicing sort of good basic health, and then you perform the marathon, most people would struggle to come out of that well or get through the marathon. So needling is similar. The skin itself, it's a living organ, and it predominantly is made of a big chunk, over 90% vitamin A, C and E. So we've got lots of antioxidants and then peptides. So when I'm feeding my skin, I'm working with its natural barrier function, I'm keeping it really healthy, and then I'm shielding it from all the artificial and direct lights. Basically, my skin is going to have a lot of resources. So when I put that stress, and stress is demands minus resources. So when you put that demand of the needling on, but your skin doesn't have all the resources, or maybe I'm not combining other therapies to help recover it well, or maybe stimulate the growth factors extra or disinfect it correctly. There's just so many extra benefits you have from combining needling with other therapies. You mightn't see as wonderful results. So that's why it needs to be discussed with how we plan for coming into needling, and also during and then post, because it's working off a wound healing system. So that tissue is going to keep regenerating, and we want to keep the nourishment up in the internal as well as the external environment to get the best outcome. So basically, Dr. Oost agreed that there was still not another therapy he likes for skin rejuvenation on top of needling, and yeah, I 100% agree. All right, so just wanted to tell you a little bit about it. All right, have a lovely day. See ya.